Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Welcome to the Pharmacy Leaders Podcast. Today I have Kane PharmD BCPS, an assistant professor and critical care pharmacist at Rosalind Franklin University. He's a graduate of Butler University College of Pharmacy, and he has completed a PGY-1, PGY-2, and gone on to secure a role in academia as a critical care pharmacist and professor. So I wanted to bring him in to talk more about what his road was as he got into PGY-1 and PGY-2 and get his good advice. So, Dr. Kane, welcome to the Pharmacy Leaders Podcast.
Hey, Tony, thanks for having me.
All right, great. Well, I want to open it up. Normally, I would ask about your leadership road, but what I want to ask for you now is, what is the road that students should take? They're getting their interview offers right now. They're trying to figure out how they're going to afford maybe 4 or 5 trips around the country, and they're going to have interview days. Can you just first, from a very 10,000 foot perspective, what's the first thing you do besides maybe celebrate a little bit when you get that interview email?
I think that you really have to be grab those dates early on. So if they're offering you specific dates, try to reply as quick as you can, because those dates are going to go quick. Depending on how the program kind of organizes the logistics of the interviews, you don't want to be trying to either not do an interview because you can't make a date or something like that. And then, of course, if you're on an API rotation, which most P4s would be at that time unless they're on break, coordinating your interview schedule with your API preceptor as soon as possible. And just be super open about it and say, these are my dates. Is this okay for me to go? If you have an API preceptor who understands, the logistics of the residency interviewing, hopefully they'll be willing to work with you. And that's super important to just be upfront and as punctual as you can. As an API preceptor myself, I don't want to hear the day before, oh, by the way, I have an interview and I can't come tomorrow. It really needs to be more proactive than that. So logistics is the number one thing to think about when you're figuring out what to do when you get that awesome email of you have that interview opportunity.
Okay, and let's say you have, and let's use this we'll kind of make a fictitious experience. Let's say you applied to 8, I think the average is somewhere around there, and you got interviews for 4. You're given a number of dates. Let's say you have enough flexibility to pick the order. Where would you put the interview that you want the most? Would you put it in the middle or at the end?
I think for me, I would probably put it in the middle, but I think it's going to depend on the person. I think for the most part, you probably don't want to have your first interview be the kind of holy grail.
No, definitely not the first. Right? It's like doing critical care as your first API. No, no.
I think that there's no harm in doing it at the end. You might start getting kind of burned out a little bit at that point, especially if you have a lot of interviews. So maybe somewhere in the middle might be a sweet spot between enough experience, but you're not getting burned out with the process at the same time.
Okay, so maybe we can just pretend you're the residency applicant and I'm going to be the residency program director, and I'm just going to ask you a couple of questions, and what I want is not only an answer but kind of your rationale behind it. So sure. The first thing that Brandon Dyson from TLDR kind of recommended is to remember that as soon as you meet a person, the interview has started. So when somebody just says, "Hey, how's it going?" what would you say?
So, I fully agree that the interview starts as soon as you park your car and as soon as you meet the first person. In terms of the how's it going, I think positivity and smiling goes a really long way. So even if you got stuck in traffic, even if you spilled coffee all over your pants, be positive about it. They want people who are going to have a positive attitude, who are interested in being there, who are personable and sociable. So no matter how bad your morning was, this is not the time to go over every negative detail. It's the time to talk about how excited you are and how much you're looking forward to the interview process, not how nervous you are and things like that.
Yeah, no, that's definitely good advice. So the first kind of questions they have tend to be very general. Tell us a little bit about yourself. Well, where do you start that? I've seen CVs from 15 pages to 6 pages. What part of the CV do you start with, or do you start with something a little bit maybe about your personal life?
I think that the big pitfall for that question is that you talk for 10 minutes. And again, kind of a general principle for any question is danger to just talking, and not having a conversation with that interviewer. So for something as simple as tell me about yourself, I think that should be like a 30-second, a little bit about maybe your path to what got you into pharmacy school and why you're interested in residency, or something unique about yourself, anything like that. But for sure, like anything more than 30 seconds for a very open-ended question like that is going to kind of drag on the interview, and it isn't going to be helpful for that interviewer because they probably have 10 targeted questions that they want to ask you. And if you spend all the time on this very open-ended thing, you're not going to get the value out of that interview that the interviewer wants to have.
Okay, so let me ask you the question and then answer it as if you're back
Sure.
in your PGY-1. So, hey, how would I refer to you? I guess as a student, because you're Dr. Kane was as a professor. So
Sean is fine.
Sean. Hey, Sean. How was your trip? Tell me a little bit about yourself, and just I want to get to know you a little bit.
Yeah, so my trip was excellent. I was a little concerned about the Chicago traffic coming from a small town where I grew up, but everything worked out great. Parking was wonderful. Be here. I'm completing my API rotation in critical care right now, and it's going really well, and that's kind of prompted me to pursue such as this residency that really helps me delve deeper into that specialty, and that's really why I'm here today.
Okay, and so you've kind of held true to the 30 seconds or 40 seconds, and you've made clear that there's an endpoint to what you want. Okay, so let's do some of the questions that are real traps for students.
Sure.
What was your least favorite API? Give us the good stuff. Tell us what, really went, what you really hated about it.
Yeah. So, and clearly you're getting to another key point is at no point from the time that you park your car to the time that you leave should you outwardly be super negative about an individual, an experience, or any aspect of a rotation that you've had. There is always a silver lining. And even if you didn't have a great experience, even if you had a bad experience, really, you really need to paint it in a way that shows that you aren't a pessimist about experiences and things like that. So to your question, a bad experience, I might say something like, probably the rotation that I had the least enjoyment out of was XYZ rotation. And it really wasn't because it was bad. It was just that I didn't feel challenged on the rotation and I didn't get a lot of value out of it. So for that reason, I feel like that could have been a better rotation for me. And I wish I would have gotten ABC rotation. And I'd heard that maybe offered a lot more value, but I did get some enjoyment out of it. It just could have been a little bit better.
Okay. So, if you could just tell us maybe about a leadership time that you had a struggle and then you overcame that struggle. So was there any organization that you led or a group that you led and you really ran into a wall, but you managed to get through that wall somehow?
Yeah. So before I answer that, Tony, I think one of the best interview tips I can give your audience is when you respond to an open-ended question like that, it's always helpful again, trying to keep your answers concise, to have kind of an introduction, kind of a body statement, and then a conclusion. And that conclusion is probably the most important part, because what sometimes happens is when students answer a question, they don't know when to stop. And because they don't have that concluding final statement, and there's like this silence, they get nervous, and then they just keep talking and talking and talking. And then they end up with a 5-minute answer, and they aren't really taking control of, that session. So for example, for a challenging leadership opportunity, I might say, in terms of the intro, I did coordinate a health screening event at my university. It was the first one ever. And the biggest challenge we had was actually funding it. And that was really difficult. In terms of the funding, the university wouldn't provide us, any funding for it. So we really had to seek external sources. And then I might go through maybe 30 to 60 seconds of who we talked to, how we ended up securing that funding. And then at the end, in terms of my interview answer, I might say, so, clearly that was a big challenge to get the funding. I'm glad that we finally were able to secure it. And that was absolutely one of the challenges that I had in a leadership scenario.
Okay. Well, I'm going to lean into you on your, just because of your role as a critical care pharmacist, would you be able to put together a case study that maybe would be a challenge for the students? Because I think what students are getting, or the ones that I'm talking to right now, they're saying, I feel like I've learned what I need to learn, but I've never been challenged under pressure with a case study. Could you put together a case study that, maybe a student could learn from, and then how to answer it? And I'm not asking you as a student, I'm asking you as Professor, Dr. Kane.
Sure.
Give me a little bit of a critical care case study that would be appropriate for someone who's just graduating, PGY-1 residency applicant.
Sure. Yeah, absolutely. Tony, you want one now? Or?
Yeah. Just go for it.
So let's say that we have, in our ICU, we see a lot of sepsis patients and septic shock, and drug shortages are a huge issue right now. So a scenario might be that we have a patient who is in septic shock, who needs to have norepinephrine, and unfortunately, that drug is now on back order, and we can't get any of it. What is your process in terms of either an alternative agent, or where would you go to seek out that information to figure out what the best alternative for norepinephrine would be in that patient?
Okay. And so before you answer the question, what rationale are you hoping that this person is going to answer with?
So, many students don't get a ton of critical care in many of the college niche topic. So I don't expect every student to answer with a perfect answer, but what I'm looking for is some amount of critical thought of when I do what they want to do. And the other thing I'm looking for is, do they have a good basis for looking up drug information questions? Because really, it's the fishing pole or the fish problem. I want to potentially interview and hire someone who has the fishing pole to figure out how to go out and get all of these DI answers. I don't know that they need to have all of the fish, all of the answers at one time, but they need to be able to figure out how to go get them. So to me, resourcefulness and drug information background is super important to be able to be an effective pharmacist. And so I'm kind of looking for or what process would they go through. So for example, if they say, well, I'd probably start with Google, that interview is not going to go very well.
Yeah, I understand. So tell me a little, let me ask you to do two answers. One answer where you've had a critical care appy and they know that on the CV, so they've seen that you've had a critical care appy. And then another one where the critical care appy actually came after, and because of the lottery system, they didn't get their critical care appy until after this interview. So the first one is they should be knowledgeable because they have an appy.
Sure. So a reasonable answer would be, I would probably decide based on their heart rate. Something like a dopamine is a typical alternative, but based on the SOAP2 trial, it looks like the risk of arrhythmia is a lot higher with dopamine versus norepinephrine. If they're very tachycardic or prone to arrhythmias, I might consider phenylephrine, even though it's not a preferred therapy. That would be a reasonable alternative depending on the patient. And then clearly based on the response would dictate, further therapy at that point.
Okay. And so some people are saying, oh gosh, I wouldn't have had that answer. I'm going to fail. This is going to go so badly. I didn't have my critical care appy. So maybe what answer could you expect from someone that has had about 5 residents or 5 appy experiences or 6 appy experiences, but just hasn't had a critical care one? Maybe they've had internal med, but their critical care because of the lottery is coming in March.
So another reasonable answer could be, I'm familiar with the surviving sepsis guidelines specifically, but I can tell you that norepinephrine works primarily on the little bit on the beta-1 receptor. So a drug like dopamine probably would be similar, but I'd have to look that up.
Okay. So again, really just not, I think students are like, oh my gosh, I'm going to forget what the answer is, but that's really not it at all.
No.
In our last interview, we talked about being practice ready. So let's maybe have a question about being practice ready, because that seems like what we're trying to evaluate. So tell us, Sean. So we'll have the two entities, Dr. Kane and Sean. So Sean, how have you worked under stress, either in your API rotation or at a job that you've had during pharmacy school?
In terms of stress, I would say that time management can be stressful. And then in terms of my API rotations that I've had with time management, it's working up your patients in an efficient manner that you're ready to go when rounds are started. So for me, time management is always something that has been challenging. So for example, when I was on my ICU rotation, I was very cognizant not just about the patient that I was working up, but how I was working up the patient, and always thinking about I asked my preceptors how they're able to work up 20 patients before rounds and, get all these great interventions in. And, so for me, one of the challenges that I've experienced is definitely that time management, especially with patient workup. And I think that I've done a good job of addressing it and getting better over time.
So it sounds like you're doing okay, tell us something that you really struggle with, but you turn the negative into a positive.
And you have to be super careful about the negative into a positive thing. All too often, like the typical example of this, Tony, is, what is your biggest weakness? And then a student who cops out will say something like, oh, I work too hard, or I'm too dedicated to my job. Those are ridiculous. So don't do that, because it's not. And everyone knows that you're just making it up. So instead, pick something that you truly did struggle with. And even if you're not great at whatever that thing is that you've been struggling with, show improvement, or show that, you've taken the steps to get better at that. That's what I'm looking for, not the fact that you work too hard. That's irrelevant.
Yeah, when I was at ASHP this year, I saw a group of residents. And then when I was in kind of my cohort, the group of residents tend to kind of act as a pack, not a mean one or a bad one, but more like, I think, if we had somebody do that in front of the 5 or 6 of us, we'd be like, boo, boo, answer the question. Right. So we wouldn't, I don't think we would let something like that go. But tell me a little bit about the one thing that I think another concern that students have is their presentation. So what recommendations do you have, Dr. Kane, for making sure that your presentation is, it's going to be maybe 5-10 minutes? I talked to Brandon and I had pictures of, people with their tubes from like ASHP, because that's kind of ubiquitous, on the plane, and, tubes on the plane, and, they're bringing it, bringing it to this interview. But how do you choose a topic if they don't give one to you? What was your experience with that, getting in front of people and just presenting a case? How much can you get away with in terms of, content? You can't do a whole trial. What part of a trial do you pick? Things like that.
So Tony, in your experience, are students typically doing PowerPoint presentations, or more like a verbal 5 to 10 minute thing that they're reading off of a paper?
I'm hearing that they're being asked to send their PowerPoint to the residency director, and that they'll make a presentation of 5 to 10 minutes, and that, people are going to be coming in and out, and, X number of people are supposed to be there, and then other people are going to try to be there. So let's say we have a room of 5 people. There's going to be a couple interruptions, but you're going to be giving an 8-minute presentation on a clinical case.
Cool. So the number one thing that students need to realize is that when you read off your slides or you read off your notes, you lose the audience, and it's horrible for engaging that audience. So the best way to not do that is to what I call detextify your slides. So just have less text. And there's a bunch of different rules of thumb, like a 7x7 or a 4x4 rule, in terms of 4 lines of text with no more than 4 words per text it doesn't matter what the rule is, but the less text you have on your slides, the more you're going to have a conversational tone, a better delivery. You're going to engage the audience. They'll be watching you and listening to you instead of reading your slides because you've included like a paragraph of text on your slides. That's the number one mistake that many students make. And if they fix it, it's also the number one easiest thing to do to make.
Okay, so I guess in terms of nervousness, how did you control your nervousness at the most important interview that you had? So some of them, they're going to be not as nervous because they have one in their heart that if this would happen and they got this residency, then their life would be complete. How do you control that nervousness, or how do you work with that anxiety?
So I think that, one, you have to think about, why are you so nervous or anxious? With the student presentation, for me as a student, my anxiety probably came mostly from, what if they ask me something I don't know, or they call me out as something that I present something incorrectly, something along those lines. And for something like that, the best way that a student can respond to that kind of a challenge is to say, that's a really good point. I'd have to look more into that. And I know that that's kind of a cop-out answer, but it's by far the most professional answer. You don't want to be arguing in terms of, well, that's what the article said, so that's why I put it there, or something like that. You need to be incredibly professional. And if they do ask you something that you don't know, or they disagree with something you said, you have to have some way to basically say, that's a great point. I need to look more into that to be able to fully answer that question or to address your concern that you're bringing up. Okay. In terms of everything else, in terms of anxiety, I don't have a magic bullet here. If it's the program of your dreams and you're finally there, I guess just, words are one thing, but being confident is really what it comes down to. So be confident in your skill set, be confident that you're a good match for the program and vice versa. That confidence is what's going to hopefully help with some of that anxiety for you.
Okay. Well, is there anything that I didn't address that you think that a potential PGY-1 student should know in preparation for their big interview days?
So I think the other thing is be thinking about what questions you want to ask your respective interviewers. So let's say you have 5 different interviewers throughout the day. They're going to expect that you ask some number of questions. Again, it depends on how long the interview is and how in depth you get with that interviewer, but it kind of shows that you're not interested in someone or in that program if you don't ask a question here and there. It's engaging. People want to talk about their program and about themselves. The trick here, though, is that you should not ask questions that are readily available on their website, like how many required rotations do you have? Something like that, not a good question. The best questions are questions where you're asking that person about how they interact with the residency, what their impressions of XYZ are, maybe how they've been involved in residency research projects. That's always kind of a hot topic because there's a lot of heterogeneity in terms of the quality of the research process and the projects and things like that. But again, don't be asking questions that are kind of obvious questions or super open-ended questions like, what is the biggest weakness of your program? Not a great question, but something like, what has your involvement in the residency research projects been? Probably a better question.
Okay. Well, Dr. Sean Kane, thanks so much for being on the Pharmacy Leaders Podcast.
Thank you, Tony.
Support for this episode comes from Good Night Pharmacology, 350 brand and generic name drugs with classifications, a leading resource for students in the United States, United Kingdom, and Australia. Print, ebook, and audiobook available on Audible, iTunes, and Amazon.com. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.